The murder of United Healthcare CEO Brian Thompson drew an astonishing reaction from many Americans. At first, it seemed implausible that anger over the healthcare system or insurance in general could be responsible. But with evidence now confirming this motive, it's clear this tragedy reflects broader public sentiment, a deep and pervasive frustration with the cost and complexity of U.S. healthcare. There is no excuse for murder. Even if there were, this act accomplished nothing. The high cost of healthcare in America is not the fault of any one bad actor or even any single sector. It is, in truth, the product of us all. That's the topic of this week's Healthcare Triage. In 2022, the United States spent $4.5 trillion on healthcare, an astonishing $13,500 per person. That's a level of spending no other country can fathom. We manage it every year through taxes, insurance premiums, and out-of-pocket expenses. This system touches nearly every part of American life, and we all carry its cost. Many, in response to this murder, have focused their anger on private insurance companies, and it's easy to see why. Private insurers are a source of needless administrative burden, with administrative costs ballooning over recent decades without commensurate benefit. The industry's profits and executive compensation are hard to ignore, often reaching staggering levels. But private insurance is not the singular villain many assume it to be. It accounts for 29% of healthcare spending, about $1.3 trillion. Even if we eliminated significant administrative overhead, profit, and executive compensation in that sector, the savings will be somewhat marginal compared to the total cost. We would still be spending far more than any other country. What about single-payer systems? Many assume these would immediately slash costs. Yet we already have a version of a single-payer system in the United States, Medicare. In 2022, Medicare accounted for 21% of healthcare spending, nearly $950 billion. On average, Medicare spends almost $15,000 per enrollee, compared to $6,500 for privately insured individuals. While Medicare enrollees are older and sicker, it's clear that single-payer systems are not inherently inexpensive, and U.S. Medicare is a source of constant debate as to its unaffordability. The truth is that other countries achieve lower costs with all kinds of systems. Sure, single-payer systems in Canada, Australia, and New Zealand cost less. Fully socialized systems like the UK's also deliver care at a fraction of what we pay. However, even nations like Switzerland and Singapore that rely more heavily on private insurance than we do spend far less than the United States. The structure of our insurance alone cannot explain our extraordinary spending. What about the pharmaceutical industry? Drug prices in the US are indeed staggeringly high, and efforts to lower them, like the recent Medicare negotiations, are steps in the right direction. However, retail prescription drugs accounted for just $400 billion, or less than 10% of healthcare spending in 2022. Even if drug costs were eliminated entirely, we'd still be spending over $4 trillion annually. Physician salaries are another frequent target. Doctors in the United States are paid significantly more than their counterparts in other countries and more compared to other professions domestically. Yet physician compensation represents less than 9% of total healthcare spending. Even dramatic pay cuts wouldn't meaningfully reduce the overall cost. So what is to blame? All of this and more. A 2022 report from the Commonwealth Fund attributed overspending in the United States to several factors. Administrative costs, 15%, inflated drug prices, 10%, high physician salaries, 10%, high nurse salaries, 5%, and overinvestment in medical devices and technology, 5%. That barely accounts for half of the excess. Other drivers might include defensive medicine, overuse of low-value care, and demand for expensive treatments with limited benefit. The blame is shared across every corner of the system. But here's the hard truth most Americans don't want to hear. This spending isn't wasted in the way we imagine. It's not burned in a pile of money or funneled entirely into executives' pockets. It's a major driver of the U.S. economy, funding the salaries of millions of Americans and accounting for more than 17 cents of every dollar spent in this country. One person's waste is another person's livelihood. Further, Most of what experts consider waste is considered care by lots of Americans. Telling them to accept less is never popular, and is one of the reasons people hate private insurers so much. The reason we spend so much more than other countries is simple. Prices. We charge more for everything. Services, drugs, devices, and administration. The only way to reduce costs is for everyone selling healthcare to accept less. And when 17% of GDP is at stake, many millions of Americans would need to share the pain. When we spend $13,500 per person on healthcare, we have to come up with $4.5 trillion. When people refuse to pay more taxes, are intolerant of any premium increases, and are absolutely against further out-of-pocket spending, then insurance companies eventually have to say no more. This would be true even if private insurance didn't exist. There's no easy way out. Every potential solution comes with trade-offs, but we do have evidence to guide us. For example, the Agency for Healthcare Research and Quality, or AHRQ, conducts research to identify practical, evidence-based practices that improve patient outcomes while reducing costs. Organizations like these provide a foundation for more innovative, more efficient care. Ultimately, no single change will solve this problem. It will require employers, state Medicaid programs, Medicare, pharmaceutical companies, hospitals, device manufacturers, policymakers, and more to act together. Demonizing any one group or industry distracts us from the hard work ahead. The cost of healthcare in America isn't just a policy problem. It's an economic challenge, a cultural phenomenon, and a shared responsibility. Recognizing that is the first step toward progress. Hey, did you enjoy this episode? You might enjoy this previous episode on why medications and drugs cost so much in the United States. We'd appreciate it if you'd like the video, subscribe to the channel down below, maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Joshua Crow, and of course, our Surgeon Admiral, Sam.